Hello everyone, this is an important topic for the NEET PG entrance examination. In this topic we are going to clear our concept on the urinary tract infection. This is from pharmacology. So I will explain you UTI with a case. 35-year-old female, fever, abdominal pain, burning as well as difficulty in micturition. There is increased frequency of the micturition since 2 days. Now what will be your diagnosis? So in this question there is what? Fever, abdominal pain, and there is burning, micturition. There is pain during micturition, and there is increase in the urgency and frequency of micturition. So it means it is the case of UTI, urinary tract infection. Now urinary tract infection can be upper urinary tract infection and lower urinary tract infection. So first, upper urinary tract infection. It involves mainly the kidney. And the features that patient will present is the fever as well as there is loin pain. Now lower urinary tract infection, it mainly involves the ureter, urinary bladder, and the urethra. So there will be burning, pain during the micturition. During the urination there will be pain. There will be increase in the frequency of micturition. These are the symptoms for the lower urinary tract infection. Now if a patient comes with urinary tract infection, what are the strategies for the treatment of the UTI? So we have to discuss about the basic approach to treat the urinary tract infection. So the basic approach to treat the urinary tract infection: first we have to treat the burning micturition. The patient has pain during the micturition, so it can be treated by using an analgesic, means pain relieving drug. That is urinary analgesic because it acts locally. So the drug is phenazopyridine. So this is the drug of choice for the burning micturition. And second approach is to treat the frequent urination. So to treat the frequent urination we have to prescribe fluvoxamine or oxybutynine. And next, the patient will present with fever. So to treat the fever we can prescribe paracetamol. And next, microbes are causing the urinary tract infection. So microbes are mainly the gram negative bacteria, like E. coli, Klebsiella, Proteus. So it can be treated by starting the empirical therapy because we don't know which exact bacteria is causing that disease. So we can use a broad spectrum antibiotic. So for that we have to use one urinary antiseptic, and next as empirical antimicrobial. So in the urinary antiseptic we have to, urinary means it is acting locally. So it will act only in the kidney. So urinary antiseptic means that can kill the every forms of the microorganism. So as they get highly concentrated in the kidney, so they are urinary antiseptic. They are urinary antiseptic. Now the urinary antiseptic include nitrofurantoin, and second is methenamine mandolate. Methenamine mandolate, nitrofurantoin and methenamine mandolate. So first, nitrofurantoin, the mechanism of action of this nitrofurantoin, it causes the DNA damage of the bacteria. It causes the DNA damage of the bacteria, and it do not develop any resistance with other antimicrobials. And it is highly active against the E. coli. Escherichia coli is the most common organism that will cause the urinary tract infection. Now this nitrofurantoin cannot be used in infants, G6PD deficient patient, as well as the patient of the renal failure. So it is contraindicated in them. And what are the adverse effects of these drugs? So the patient must be aware about that his urine will turn brown on exposure to air. So he may suspect that there comes blood in the urine, but it is normal with this drug. So you have to make the patient clear about these things so that he won't get panic. And next, methenamine mandolate. Methenamine mandolate is simply a prodrug. It is not in an active form. It first enters in our body, then it converts into active form. So it is a prodrug and it get converted to formaldehyde. Formaldehyde, it is an antiseptic, and it is highly dangerous and corrosive. So this formaldehyde, it is taken inside our body in the form of methenamine mandolate. It is a prodrug, and this drug get converted into formaldehyde only at the acidic pH. And inside the stomach there is acidic pH, but this methenamine mandolate won't get converted into formaldehyde in the stomach, because this methenamine mandolate is a enteric coated tablet, so it won't get converted inside the stomach. If first it get absorbed at the level of the small intestine, which has pH alkaline, so this get entered into the bloodstream, reaches to the kidney, okay, and that it gets secreted in the kidney tubule, and after secreting into the kidney tubules, it gets the acidic pH there, so it get converted into formaldehyde at the level of kidney, inside the kidney. Okay, now it will start its mechanism of action, that it acts as an antiseptic inside the kidney tubule, that it kills the bacteria that is present in the urine. So this way, this is the mechanism of action of this methenamine mandolate, and this methenamine mandolate is enteric coated to prevent the corrosive nature of the formaldehyde. Okay, so if it get converted into formaldehyde at the level of stomach, it will hamper the stomach. Now first we have treated the pain. Okay, we have treated what? First we have treated the burning micturition, then we have treated frequent urination, then fever, then microbes. For microbes we have one urinary antiseptic, then we have the empirical antimicrobials. Okay, in the empirical antimicrobials we have beta-lactam antibiotic. In the beta-lactam we have penicillin group and cephalosporin. Penicillin group like amoxicillin and clavulanic acid combination we have to provide, and in the cephalosporin we can prescribe cephalexin, cefadoxime, proxetil. These are the oral drug in the cephalosporin. Similarly, ceftriaxone is a intravenous drug in the cephalosporin. Okay, now other antimicrobials like fluoroquinolones can be prescribed, but we have to note down that this ciprofloxacin, it is contraindicated in the pregnancy. So in place of ciprofloxacin, if it is pregnant case, so you have to prescribe norfloxacin or ofloxacin. Okay, now next is cotrimoxazole, others are fosfomycin. Okay, so these drug can prescribe if the report is still late to come. Okay, bacterial multiplication can be controlled. Okay, now once we get the culture report, we have to start the specific antimicrobial therapy. Okay, what is the specific bacteria that is causing? Okay, so for that we can start the antimicrobials. Now we have to know some important points like extended spectrum beta-lactamase producing E. coli or Klebsiella. Okay, there is ESBL, so the drug of choice for these bacteria is carbapenems, and these carbapenems, if not applicable, we can go for beta-lactam or beta-lactam plus beta-lactamase inhibitor. So this beta-lactamase inhibitor, it will inhibit the enzyme produced by the beta-lactamase inhibiting bacteria like E. coli as well as Klebsiella. Okay, now what are the drugs that cannot be used in the UTI? Now they are resistant, they are mcqs and tigecycline. Okay, now if a pregnant woman get affected by the UTI, then in that condition the drug we can be used are amoxicillin, cephalosporin, nitrofurantoin as well as cotrimoxazole. Okay, these drug can be used. We have to avoid this cotrimoxazole in the first trimester of the pregnancy, because this cotrimoxazole, it can displace the bilirubin, okay, in the fetus. Okay, fetus, it can displace the bilirubin, so that the child will born with hyperbilirubinemia. So this cotrimoxazole should not be given during the first trimester of the pregnancy. It can be prescribed in the second, third trimester of pregnancy. Okay, but other drugs, they are safe in the first trimester as well. So this is all about the urinary tract infection. This way we can treat the patient coming with urinary tract infection. I think you have understood all the concept about these topics. Okay, if you like the video, please subscribe and share among your friends so that it will be helpful for them. Okay.